Welcome. It's episode 33. Thank you.
That was nice.
Yeah, I'm also moonlighting as a WWE announcer now.
Wow, I was not expecting
That's what I was
twist.
practicing for.
That's
You like the crows, man. I don't know what to
not
tell
a
you.
crow. I think that's a blue jay. It's just being really aggressive. I heard a hawk a minute ago, and that's probably why I'm hearing crows
Probably.
right now. Or not crows, blue jays right now.
Anyway, welcome to episode 33.
Welcome to our bird cast. And if you didn't know, your fun fact of the day is that blue jays will pretend to be a hawk, and they will make a hawk noise to clear bird feeders so they can gorge themselves in peace.
Oh, nice. I don't mind because blue jays are pretty.
I hate them.
Oh.
Assholes.
Cool.
I do like that they scare away hawks, though. They will fight hawks. And I'm always afraid hawks are going to scoop up my little old dog, so...
That's fair.
Yeah. So I will accept the blue jays, but not willingly.
So anyway, last week we left off.
Oh, I'm Garrett.
I'm Katie. And this is our Stream of Consciousness podcast.
Yes.
But last week we left off discussing PCOS and diabetes mostly. We got a little bit, I think, into infertility, or at least hinted at it.
I'm not sure exactly where we landed, but
But yeah, so
usual.
we're picking that up today. But good news, I didn't do any more research, so it's still all Garrett.
Yep. Stuck with me.
Stuck in the middle with you.
And Katie's been truly like working with a karaoke machine today. It's been a lot of songs that really don't have to do with what we're talking about.
Clowns to the left of me, jokers to the right. Here I am.
What was the
stuck
Buttons
in
one?
the middle with you. Oh, it's like a Pussycat Doll song. I'm gonna loosen up my buttons, baby, 'cause they're buttons.
She's gonna get fired by our editor today.
Whatever.
They're gonna listen to this and be like, "Oh my god, again." But anyway,
He probably side texts PK and it's like, your girl is whack.
it's like I hate this.
Yeah.
They're so lame. So yes, we are gonna pick up that conversation, and we hope you enjoy.
Yeah.
So, after all of those really uplifting side effects, another thing that it can cause is infertility. So PCOS, obviously, as established, interrupts the normal menstrual cycle. So by nature, that's going to make it harder to get pregnant. Between 70 and 80% of people with PCOS have fertility problems. So you think about how many people have it and don't know it, have it, don't know it, and have fertility problems.
Right. So obviously you knew when you were going through fertility treatments, you knew that already that you had PCOS, but I wonder do you know if they test for PCOS before they...
So we tried for like 6 months, and I talked to my gynecologist, and she ran blood work and was like, yes, this is all very typical of PCOS. And then when we had the intake blood work done with the infertility place, they were like, yes, this is like textbook, all of these numbers.
Oh, okay.
So you can
I wonder if they do kind of
see
screen it.
Yeah.
Then.
So outside of PCOS, the general population is dealing with infertility rate of 1 in 5. I've seen 1 in 5, I've seen 1 in 7.
Still pretty high.
It's still a lot of people. And sometimes it's just like unexplained infertility, which like I can't imagine. At least I knew
that's
what was
true.
Causing mine.
Yeah.
But PCOS also increases the risk of pregnancy complications. So women with PCOS are twice as likely to have a baby prematurely. Higher rate for miscarriage, and a higher rate of preeclampsia / high blood pressure and gestational diabetes.
Wow. Have you done that glucose test yet?
No, I think I do that at like 26 or 28 weeks.
What do you know?
Huh?
What do you know?
I'll be 18 weeks on Monday.
Oh, okay.
So I've got a little bit to go.
Yeah.
So I have dealt with PCOS related infertility. My body does not release the proper amount of that luteinizing hormone to cause the eggs to fully mature and release. So I have that pearled appearance because my body's like holding on to them. So one of the ways that they can see that, aside from the imaging, is one of the components of the panel of blood work that they do is for an anti-Mullerian hormone. AMH is how it's abbreviated.
Anti-malaria hormone?
Mullerian.
Oh.
It's a U with
anti-mosquitoes.
Yes. Yes. It's like a U with the umlauts or whatever over the top.
Okay.
Llerian. So that hormone is made by the ovaries. So usually when they're measuring AMH levels, it can provide information about like a lot of different reproductive types of conditions. But ultimately it kind of indicates your ovarian reserves. So if you look at like a table, they'll have like, okay, age this is normally this, and age this is normally this. So over time, obviously, as you release eggs, your ovarian reserve is going to decrease. So the normal number is like for 30 to 35 is like 2.5 to 1.5. I don't even know what
eggs.
No, it's. Do you want them over easy, scrambled, poached? I don't know like what the unit of measurement is, but that's like the number is like 2.5 to 1.5. Mine was 17.8 because I have all of these eggs that I'm not releasing. So I just had all of these little eggs just hanging out in there, not getting released with each cycle.
Clubbing.
Holding on to them like I'm an egg hoarder.
Is it true that when a person with ovaries is born, they have 100% of the eggs that they'll ever have?
Yeah, so like right now, so we're having a girl. She already has all of the eggs that she's going to have in her whole life. So I'm carrying not only my child, but if she has any children.
That's pretty cool.
Isn't that a cool way of looking at it? So yeah, like when you're born, you have all the eggs that you're born with. And it's I don't remember what the number is. It's a shit ton.
Yeah.
And they either, they die off, they get released with in theory, every month for like 30 years of your life ish. You're releasing an egg, and sometimes you release 2 eggs. So yeah, mine was like off the charts. So I got that and I was like, oh my God, I'm an overachiever.
I'm so fertile. And they were like, that's not what that means.
They were like, no, it's bad actually. It was so funny. I was like, oh my God, if 2.5 is fine, then 17 must be great. And I was like it literally the
blood
first
type
thing that
A
comes
plus
up is like, this is also an indicator of PCOS. I was like, oh, fine, whatever. So we tried to get pregnant for like a couple of years without luck. So we wind up having to use science. One of the nurses that I had a conversation with at the fertility place that we were working was saying she had a background in OBGYN. And when she started working there, she was like so confused by the treatment plan, like the process for all these fertility treatments. Cause she's like, I couldn't figure out like what the process was, like what sequentially is supposed to happen. And the way the providers explained it to her was like, no 2 patients are the same. And the process is so unique for everybody that there's like no 2 treatment plans that are going to be identical, which I thought was really interesting. And also
so
terrifying.
Overwhelming.
Yes.
Yeah. I guess that explains why they don't study it.
Yes. Because there really is just like, yes, there's like 1,000,001 things that cause it. So what they do.
Pregnancy or infertility?
Infertility. I think there's only one thing that really causes pregnancy.
Yeah, not the butthole.
No, not
the Poophole loophole gets the Mormons through. I'm sorry.
This is like Katie today, as if like you had one of like, when you're playing a game and you spin the dial like on Twister. It's like, what crazy thing is she gonna say? Poophole loophole? Maybe. Gangrenous flappy doodles? Also maybe.
It's like a cursed magic 8-ball.
Yes. That's exactly what it is. We should add that to our merch. The cursed magic 8-ball.
Yeah.
And Poophole loophole could be the one that's up on the... She just got so excited. Yeah! It'd be perfect like on a sticker.
It would be great.
Yeah.
I'd slap that on my water bottle, no problem.
It was the slapping that just... I was expecting it. So my like the treatment that we did. So they do an intake where you have like they took all the vials of blood. I don't. There were so many vials that they took. They do a full health history. Like it took like an hour and a half with them to go through like my whole family's health history, his whole family's health history. They do genetic testing. They do uterine imaging, which was done with like a saline solution and an ultrasound.
A saline solution?
Yep, that they pump into your uterus. And then it like basically runs right out so you feel like you're peeing yourself.
Cool.
Then they do fallopian imaging, which I thought I was going to barf in front of a bunch of people.
Oh,
It
that was the thing where
so
they like
uncomfortable.
inflated your whole stomach or something.
Yeah,
right?
so you lay on a table and they put this thing in and they basically inflate your uterus and then they put like contrast dye in so they can make sure, and then they do x-rays. They make sure that your fallopian tubes are clear, that you don't have anything like obstructing your, because they really need to make sure, okay, is there any structural reasons why they're not able to get pregnant?
I love that they do it all without pain meds for you though. That's so nice.
It was like, so it doesn't last a super long time. Like it lasted maybe a minute, but I was straight up like,
it's a minute of pain that I
Am
bet your
I
husband
out?
has never felt.
no. I was like, am I going to vomit right now? And I then, of course, me being like now nervous in this situation because I'm legitimately afraid I'm going to vomit. The radiologist came in. So like I'm on the table, the nurse practitioner is there with me, like doing the inflating or whatever torture device she was using. And he goes in like to the little booth and he like introduces himself. He's like, oh,
God.
his name was, I swear to God, it was like Dr. Cramp. And I said, well, that's fitting. And I like kind of laugh at myself because I'm like, that's a funny joke that I'm experiencing this over. I'm assuming it's probably what like a contraction feels like. But when it comes out of fucking nowhere, it really hurts. So I was like trying to breathe my way through this. And he was like, excuse me? And I was like, cramp. I'm uncomfortable. Cramp. It was a joke. And he was like, oh, that's funny. Sir,
He's a hit at parties.
throw me a fucking bone here. I am uncomfortable. Laugh at my stupid joke.
That's like having a name like Dr. Finger and you're a proctologist. Like what?
I really thought you were going to say Dr. Fart, which also would have worked for proctologist.
Also, yeah.
Either way. She was like, oh, yeah. Yeah, what? That also would have
I'm
worked.
Dr. Finger and this is my partner Dr. Fart. Welcome to Fingers and Farts Proctology and Associates.
Down the hall is Dr. Fuck. He can take care of all your...
That's the sex therapist.
Oh, I was going to say urologist.
Oh.
I guess that fuck probably isn't. Anyway.
I hope not. I mean, unless you're Donald Trump. Got him.
Oh, we're going to get fired from our own podcast.
I stand by it.
So what they would have me do every cycle, you would wait for your period to start. You would have to call them when you got your period because you have to go in between like days 1 and day 3 of your cycle or something. And you would have to go in for baseline blood work and an ultrasound, a transvaginal ultrasound. So
While you're bleeding?
oh yeah, that's a nice touch.
And you had to guide it into yourself?
There was only like 1 or 2 people. Most of them just would like do it. Which please just
Yeah, I'd rather you just do it.
like don't get me wrong, I appreciate the
I mean, I guess I don't want you like
consent component of it.
shoving it all of the way like too far in, but like
You're a professional. You should know how far it needs to
I
go.
would think, and also, I mean, it's imaging. You can see where you are.
Right.
It's not like
Right away.
you're diving blind.
I mean, you kind of are, but you're also not.
Right. Yeah. Like
So they would, I would do that, and then they would have me start on, there's a few different medications. I feel like they told me for PCOS specifically, they use letrozole, which I think that's the generic name for Femara, which is actually breast cancer medication.
oh.
But what it does, so when you take something, or Clomid is another one that people do, but
Oh,
they
I've
don't.
heard of Clomid.
Yeah, and that's like it's the same type of medication, but I think the letrozole is supposed to be more effective with PCOS specifically.
Oh, okay.
So that helps to thicken your uterine lining and it helps those eggs mature. So you do that, and then after you take the medication, which for me, it gave me hot flashes.
Yes,
Like
you were
I would
very spicy 100%
Oh
of the
my
time.
God. It was like, I mean, in the middle of the night, you would wake up like in a full sweat, like a hot, like menopause, like a hot sweat,
Huh, it's not a cold sweat.
all the sweats. So then they would have me go back, do the same blood work, ultrasound to make sure the follicles were maturing. And usually, based off of that, you would either have to go for another check in a couple of days, or they would say, okay, like if you're at this point on this day, then in like this many days, you should be good. Um, so we try to cycle to see like if my body would surge on its own, which is when you have that LH surge that then causes your egg to actually release.
Mm-hmm.
Um, I was able to surge once on my own, but it was not a successful cycle. So the other thing that they do is when you reach the point where you're coming up on when it should be surging and the follicle's the right size, they'll have you do a trigger shot, which is actually a dose of HCG that you just like self-administer at home, which is that pregnancy hormone that we talked about way back in the pregnancy episode. And that kind of then I think it's like a 36-hour turnaround time when it's supposed to actually release the egg. But ultimately, it took us like multiple rounds. We wound up doing IUI because it was not
Which stands for what?
intrauterine insemination,
Okay.
which is kind of like the step between there's like ovulation induction, which is what we tried for a while. There's IUI, which is where they're just like a farm animal. Again, the farm animals are coming back up. They're just injecting you basically, which again was something that everybody was like, it's not that uncomfortable. Super fucking uncomfortable because they're dilating your cervix.
And it's not a Cheerio.
And it's not a Cheerio.
Mm.
And then or an almond. And then there's also IVF where they're like increasing your egg reserve and then retrieving the eggs and they're doing all of the fertilization
Yeah,
outside
in vitro
of yes.
fertilization.
So instead of injecting you with semen that they like wash and spin down, she told me it was washed semen and I was like, that sounds gross.
You know, Dawn never puts that in their ads. It's always the duck covered in oil.
I really wish it was like a man just dressed up as semen getting like hosed down and squirting them with Dawn. You're welcome for more imagery you didn't want in your head.
Yeah, I know that with in vitro they like take the eggs out of you that you
Yes.
have actually ejected from your ovary.
I think they're taking them right from your ovary.
Oh, okay.
I think they give you a medication to like I think you're probably doing the letrozole to make sure that like you've got follicles and then they're retrieving them. They're fertilizing them, waiting until you have embryos.
They take your Dawn sperm.
Yep.
And then
and your
squish them
retrieved
together.
egg.
Yeah,
Yep.
and then they put the
embryo.
Yeah. In.
And then obviously you're hoping for it to implant. So, if anybody listening to this has gone through this or is starting the process, it's so stressful. It feels like it's endless. Sometimes for some people it is. I mean, there's the disruption physically. Like all of my appointments were at like 6:00 in the morning.
Yeah.
And it would be like 4 to 5 appointments per cycle. So while my spouse was sound asleep in a warm bed, I was getting up and trying to find clothes where it would be easy to pull up my sleeve for blood work, but also easy to take my pants and underwear off and my shoes.
You haven't been single recently because that's how like I pick all my outfits.
That's true. It has been a while since I've had to assess how easy it was to take my pants off.
Yeah.
There's also, I'm really lucky that my health insurance covered pretty much everything, although we did get a real nice $1,600 bill for blood work, but thanks to Katie, helped me write a letter to my insurance company and appeal it, and they paid for it.
See, who says lawyers aren't helpful?
Who says lawyers aren't helpful?
People who don't like lawyers.
Oh. And it makes it like really hard to plan anything because you don't know where you're going to be in your cycle and what if I have to have an appointment, and you're also not supposed to be like drinking during any of this.
Which is why, like, again, it's that thing.
So stressful.
Yeah, like I think you mentioned it in the last episode, but it was like, or in the PTSD episode, but like you're you're there because of all the construction and everything that's been going on and the shitty weather and then like the disruption at work and having that whole schedule
Oh,
changed.
sorry.
You haven't been able to do those things that you usually do to self-soothe, like
Right.
cleaning and walking and
Yep.
like exercising. But then on top of like this whole disruption to your regular schedule with these 6 a.m. doctor's appointments before work,
Yep.
and then, you know, potentially having afternoon appointments and then having to take all these medications and make sure that I remember one time you had to get something delivered and it had to be
Oh,
like
yeah.
refrigerated.
So
So you had to like make sure somebody was home and like you're
Yes.
coordinating all of these schedules.
the injectables that the Avadril, which is that HCG injection, has to be refrigerated. So they initially were like, you have to be home to receive it.
Yeah.
And then you find out later that it's in a refrigerated thing and it can sit for 24 hours without having whatever.
Yeah. So like you're working with all of that,
Right.
but then on top of it, you can't have a glass of wine or a beer
and it's,
or
you can't
whatever.
travel because you don't know what
Yeah.
you're. I mean, you probably could travel, but I was just so afraid of like
exactly
missing a cycle.
And it's that thing of like, if I miss it, will I lose the progress I've made in
Totally.
like tricking my body to let me get pregnant
Yeah.
up to this point?
Yeah.
So like you don't want to stop, but then you have that question of like, I mean, I know that you went through this thing of like, well, how long will we try? And like,
Oh, yeah, 'cause you have
how
to make
much of
that
this
call.
is worth it?
Right.
Yeah.
And there's also the component of like, so they tell you if you can't get, I want to say 6 months. We gave it way more time than that because I was like,
You did like all through COVID, you were trying.
yeah, I was
at
like,
home.
I'm not going to try and,
Yeah.
I'm not going to involve science like way faster than I need to. Another thing that they did not tell us, me really, the first period that I had after taking the letrozole, like our first cycle, was one of the most intense periods I've had. And one of the ultrasound techs, like, very offhandedly mentioned to me, oh, because the medication you're taking thickens your uterine lining, it's probably going to be a really intense period. And I was like, nobody ever fucking told me that this whole time. So if anybody is going through this process, just be aware.
FYI.
If you're taking something like Clomid or letrozole, there's a very good chance that if you have an unsuccessful cycle, you're going to have the period of all periods.
But you know, somedays.com/the bars ankle high,
Yes.
because
Oh,
that cramp
kit that
cream
we
and
got?
the mask, like you can use it as like a mud mask or like a bath soak. I feel like that would be really
I
nice.
can't wait to use that heating pad.
Yeah, I'm pumped for the heating pad, especially just that it's weighted.
And the shape of it.
Yeah,
It's shaped like a pelt. Oh, it's just,
yeah. No, the
chef's
heating pad
kiss.
is nice.
yeah.
Yeah, I'm pumped.
Yeah.
It's too bad that you're not having a period now.
Yeah. Because, man, that would all be real handy.
The
I
cramp-
saw this stuff and I was like, oh my God.
I know, especially the cramp cream. Like I would for sure be using it on my shoulders because I get
Ugh,
so tense when I'm like,
yes.
because I know my low back is gonna hurt, but like as a result, I'm like overcompensating in my shoulders. Ugh, it's the worst.
Yeah, that stuff it's amazing. And like we really, I really lucked out because we only lived like 15 minutes from the office.
True.
There's people who live, an hour from the nearest office, and this is not this course of treatment you can't get through like your OBGYN.
Right.
You have to go to like a specialist for this. So I mean, it's, 6 a.m. appointments. There are times where I was up at 5:30 in the morning trying to get myself ready for the day so I could be out the door by, 6, so I could be to my 6:05 appointment or whatever stupid time they would give you. And the most frustrating thing is there's sometimes where, if I was there that early, there wasn't a lot of people there, I could be in and out in 5 minutes.
Mm-hmm.
And then I'm sitting there like, now I don't have to be to
Now,
work for an
yeah,
hour.
now I'm wide awake with
Right,
nothing to do.
I can't go home. I can't go back to bed. So it's just like, it's super disrupting to your schedule. And like, who wants to start their day out with? There was one day I went and I had blood work done, and I was like, normally I didn't even need a Band-Aid.
Yeah.
I would put one on anyway. So I was like, I think I'm good. And I stood up and I was bleeding all down my arm, all over the floor. I was like, oh my God, I'm not good. No, I need a Band-Aid. I lied.
Oh my goodness.
Just like, oh. So yeah, it's just like a very stressful process. And I have to think of it like we didn't go the IVF route. Like we went the least invasive of these, and it was still like so incredibly stressful, taxing, like
Well, and I mean, even leading up to it, before you got the fertility group involved, like it's still stressful because, every month it's like, I mean, even at that point, it was like, am I even going to get a period?
It,
So, like,
let me tell
especially
you,
with PCOS.
before even going to this, I was so relieved the first time we had a conversation with the provider because I was like, can I stop taking my godforsaken temperature every day? Because one of the things they tell you to do, which I feel like is pointless for PCOS, is taking your temperature every day. And it's not just taking your temperature, it is literally like the second you open your eyes, you have to take your temperature. And the thermometers that they use for your, I can't even remember what the name of it is. There's like a special name for it. The type of thermometer. But anyway.
Anal? Rectal?
Nope, it goes in your mouth. Poophole. Loophole. Nope.
My special brand of thermometer, the Poophole Loophole thermometer.
No, it goes in your mouth.
Well, if I had a nickel for every time I heard that one. Sorry.
It's your basal temperature. And it's the same as a regular thermometer, but it goes to the hundredths, not the tenths after the decimal point. So it takes forever for the reading to come through because it's like more accurate. So you're literally, I would put it in my mouth. I would fall asleep with it in my mouth and then it would beep and I would wake up and then have to like record the thing in my phone. It was just like.
And why?
So it's supposed to be that like when you go through your cycle, you have your temperature is supposed to increase right before you ovulate. So it's supposed to help you predict ovulation. You can also do test strips, but if you have PCOS and you don't know when the fuck you're going to ovulate or get your period, it makes it really hard. I'm like, I'm not going to buy 10 million test strips.
Right.
So yeah, PCOS adds a layer of unpredictability. I think like if you were just regularly trying to get pregnant, all of those things would be great tools. But if you don't know, if it's the Wild West,
yeah,
with your reproductive organs and you don't know what's going to happen, then I mean,
well, and then it's, if you're, 70% of the people who don't know that they even have it,
right?
You're doing all of these things and
Yep.
being like, why is my temperature never changing? Or why is...
It was all over the place.
Yeah.
I would look at a chart and I'm like, how the fuck am I supposed to predict what? This predicts nothing.
Right. Like either I ovulate every other day for a week or I don't ovulate for 4 months.
Yes.
And then either way, I'm misting.
I'm misting all the time. I don't even know why am I damp. So yeah, it's just like, that was one of the things I was like, in the middle of the conversation, I'm like, wait a second, can I stop taking my temperature? She was like, yeah. I'm like, oh, thank God. It's just like one of those things that was so annoying to have to do.
And then she was like, you know what? I'm just going to blow up your uterus just for saying that.
You know what we're going to do instead?
Inflate the fuck out of it.
So we wound up, and if you're going through this, I do recommend like taking breaks. Like we took a summer off and man, like it was so necessary. It was just, it's so stressful. And we had gone through like 3 or 4 cycles that were unsuccessful. So we took a summer off and
started a podcast,
little traveling. But they told me, because I was like, is it okay if we like take a break? And she was like, yeah, just don't take a break for more than 6 months because then we have to do the intake stuff again.
Ugh.
And let me tell you, you want to motivate me? Yeah, I literally made an appointment. It was like, I got my period at like month 5. I was like, thank God. Whew. But even then I would have called them and been like, then give me the progesterone so I get my period because I am not doing that fallopian imaging again.
Oh, absolutely. I mean, realistically, I understand why they'd be like, well, we have to make sure. I'd be like, well, let's just trust the process here. Like,
my fallopian tubes are fine.
Yeah, nothing else was up in there.
We know what the problem is.
I keep hardly anything in that.
We know that my ovaries hoard.
Right.
Fallopian tubes, on the other hand, clear as bell. No problems. So I would definitely recommend if you're doing all these things back to back, definitely take some downtime in between, take a few cycles off. Shake off some of the stress of it because it is so stressful. And it's funny because like you'll read the all the paperwork that they give you at the beginning, and it's like, make sure you consider going to therapy because it's a really stressful process.
Fuck yeah.
Yeah, I also wound up on Zoloft, which definitely helped with the stress of that.
Right after you got IUI'd.
Yeah, I like had IUI, started on Zoloft and then found out I was pregnant within like
Well, that's
3
not
weeks.
the exact order. You had IUI, then your oven broke the day before Thanksgiving.
Oh,
Then you started Zoloft, and then you found out you were pregnant.
that's true. Our oven did break.
Your oven broke, and then you were like, I think I have to go on Zoloft. And I was like, that is the right choice.
Yes. I forgot about that also horrific component that happened. That was there's been a few times that I've really hit critical mass to the point that I literally had to just lay on the couch and stare at the ceiling.
Mm-hmm.
And that's exactly what happened.
Yeah, that's fair because, yeah, I mean, as the, yeah, for sure. I mean, it's just, it's the kind of thing where it's like there's no workaround really for that when you're hosting Thanksgiving.
Yeah.
So, like, if you were just going to be like, oh, I said I was going to bring a dessert or whatever.
No, I can't. Then yeah, that would be an excessive reaction, Garrett.
Yeah, no, that would be an excessive reaction. But like in that case, because especially you can just go to the grocery store and get like one of those lovely cheesecakes from those nuns. Those are good,
Those
right?
Nooski treat. Oh my god, they are so good.
My mom is so mad that they're not gluten free. She
Ugh.
loved them. Yeah, they're good.
Is there flour in the?
It's the crust.
Oh, I'd be.
Oh, I mean,
Skinning it.
my mom has said, I mean, they might put flour in the batter though. I put flour in my batter.
That's what I was trying to remember. I'm like, is there flour in it?
If I make it for her, then I put cornstarch, but
Yeah.
it's just like a tablespoon, but it'll set her off. I mean, she'll be violently ill. So, yeah, no, she said if she ever gets a terminal diagnosis, we'll know because the first thing she's going to do is get a Big Mac.
Oh, I can't blame her.
Yeah, I was like, that makes sense. I would probably do the same thing. Like,
Yeah.
it'd be like that scene from Dr. Dolittle with the lady who can't eat shellfish and like denies that she has a shellfish allergy.
And then, your face is blown up.
Right, exactly.
So anyway, yeah, like everything else we talk about on this podcast, do what works for you. Be patient. Be kind to yourself. I definitely would periodically wind up. I think pretty much every time I got my period, which is like you figure the hormone series of events that happens anyway, I feel like it makes ADHD worse.
Totally.
It would make my anxiety worse. I was also like super fatigued, which makes all of those things worse. And then finding out like I had another unsuccessful cycle. This means I have to start this whole process over again. It's so disrupting. Like,
well, and it's just, like disappointing. Like when you
Totally.
want to be pregnant, you want to have,
totally.
a child and your spouse is also disappointed, but then I'm sure there's like a certain dynamic with your partner because there's nothing that they can do to fix it. And I feel like especially for men, like I know that PK would struggle with not being able to do anything.
Oh, definitely. And like knowing that I was really the root of it. And they tell you like, it's not, there's no blame. No, like, yeah, but if there's two of us and
right,
and
like
my body is the one that's causing the
right,
problem.
like I know I'm not to blame, but
at the same
the
time,
reality
it's
is
my body that's
yeah.
causing the problem. Especially when you're sitting there. Like I remember the worst one was I had thought I was pregnant, got my period, and it was like a day before Mother's Day or 2 days before Mother's Day. And it was just like the timing was terrible. I felt terrible. I actually wound up using a sick day at work and I like went to like a garden center or something. I got the garden set up for the season and it totally helped and I felt much better. But,
and it's also that thing of like, I know that you've heard it before. I don't know if you heard it this time that you're talking about, but like, oh, well, dogs count too. And like,
I cannot tell you. I mean, I don't want to speak for other people. This past Mother's Day, so Mother's Day 2022, I would have people asking about Mother's Day, talking about Mother's Day, what their plans were for Mother's Day, and then saying, oh, well, you're a dog mom. There is nothing more fucking condescending for you to say to me right now. And of course, like, I'm not openly telling people, like,
right.
Hey, we're going, because it's not something you really want to talk about.
Totally.
I think there's like a component, and it was so hard for me because part of me felt like, well, I don't want anybody to think it's like a secretive thing that like they shouldn't talk about with people. But the flip side is, I don't think people understand and they don't know what to say. So, and then there's, on top of that, the component of when you have, like, you don't want to tell people when you're going through a cycle because then they're going to ask you questions. And then when you have an unsuccessful cycle, like I'm already having a hard time with it. And now I have to like talk to this other person about it.
For sure. I mean, I didn't ask you how your IUI went, other than
Right.
like, how are you feeling the day that it
And
happened?
I was like, that was fucking awful. And everybody's a liar. And I'm on my couch.
But I didn't ask you like,
No.
how are you feeling? Like,
Yes.
are you feeling nauseous, or do your fingernails hurt, or whatever the like mild weird symptoms of early pregnancy are?
Oh yeah, I didn't have that one.
Yeah, one of my friends did. She said that she knew she was pregnant with her third because her fingernails hurt.
That's wild.
Yeah, it was like that her nail beds felt like really tender.
Huh.
Yeah.
No, my indicator was my PMS order would
What?
my like the sequence of my
Oh.
PMS was always that my my nipples would hurt first,
Okay.
and they'd be super super sensitive, like not like even clothes touching them hurt for like a couple of days. Then my boobs would hurt really bad, and that would go on for like a week and a half, and then I would get my period. With this, when I was pregnant, and I of course after so many like unsuccessful cycles and trying for like 2.5 years by the time I got pregnant, I didn't want to say out loud that I thought I was pregnant, because I'm like, yeah, this happened. Like, there was like probably 2 or 3 cycles ever that I legitimately thought, and those were like the worst periods I had, because you were like, your body was gearing up for a really intense cycle. So I didn't want to like say it out loud, but I was like, oh, my boobs hurt real bad, but the sequence was not that my nipples hurt first and then my boobs. It was just my boobs hurt. So I was like, oh, this is a little bit different. Like, I do feel like I'm PMSing, but it's different. And even then, like, we had a pregnancy test scheduled, and I had one test left from our
A home test.
Yeah, a home test left from my unsuccessful cycles. And I was like, well, I have this one test left. Let me do it at home, because I was going to be in the office, and I didn't want to be like blindsided.
Because you also had to go to all of these appointments alone. Your spouse
Yes.
wasn't allowed to go with you.
Well, that was the other thing too, is like, it was so stupid to me, because when we did the intake stuff, we obviously both had to go, because he also had to have like a semen analysis done. He had to have blood work done. But when I was going for like follow-up stuff, like I went to everything by myself. So you do your blood test, and it came back.
This was 2022. Like, this wasn't April and May of 2020.
No.
So like the extreme protocols
So
here
extreme.
was very frustrating, and it was like so bizarre to me, like especially for like
It
the
seemed
IUI
arbitrary.
and the
Yeah.
fallopian imaging, like
Yep.
these painful procedures. Like, you don't have your support person with you.
Nope. I had to go by myself.
Yeah.
And we had the blood work done, and then the blood work came back positive. And then you have a 7-week ultrasound, and then they like graduate you back to your OBGYN's office. And the 7-week ultrasound, he was not allowed to come to. So like literally the first time we were like going to see the baby, he couldn't come to that appointment.
So weird.
And we went 2 weeks after that, we went to our obstetrician's office, and they were like, yeah, of course he can come. I was like, well, this is Planet Bullshit. And the last place wouldn't let him come.
Which is also very weird, because it's almost like it's divorcing you as a couple from experiencing the pregnancy together.
Yeah.
And everything that it entails. I mean, like, because, okay, so like naturally conceiving, like the old-fashioned way, you, I hope, are in a loving relationship, and I know that you are, but like people who do this.
What are you trying to say?
You are experiencing an intimate moment with your partner when you are conceiving the baby.
Right.
So you have the creation, quote unquote, of the initial embryo.
You know, when life starts.
No.
It's just so absurd.
The injection of the unwashed sperms.
The injection before the ejection. The unwashed sperm. The filthy sperm. The dirty sperm.
But like, that's an intimate moment, and something that like is, I think, when you're with somebody that you really love, is a beautiful thing to be able to share. Yeah. And so then you're not only kind of that part of that pregnancy process is already, taken away from you.
Right.
By having this kind of, even with before the IUI.
Oh yeah.
With the trigger shots, it
and it
takes the romance out of it.
Like, you have friends that they're like trying, and then they like go through the whole process of like a home pregnancy test, like being together and the whole thing. I did a home pregnancy test. My spouse was traveling when I did it, so I was by myself. At like 5 o'clock in the morning. I'm like, what the fuck do I do with this information now? I can't tell anybody. I can't even tell him because he's not awake yet.
I'd be like vibrating.
I was like,
I can't believe you waited like 3 days to tell me, frankly.
oh, I did. Yeah.
Yeah.
It's actually the only other person that knew, one of our Patreons actually, who lives pretty far away, like knew that we were like going through the stuff. So, and she knew my test was the next day. So she texted me, how you holding up, champ? I was like, well, listen, I did a test this morning. She goes, okay, so we're feeling impatient. That's how it's going. I was like, yes, we are.
But also happy.
It was also positive. So yeah, it was very frustrating. They also don't let you record anything. So I couldn't even like record a little video of the ultrasound because you could see the little flicker of the heartbeat.
Oh, cool.
So I wanted to like show him that. No,
Right.
you can't.
Yeah, and so like I also think, I mean, I've heard that men in particular can like struggle with feeling connected to the pregnancy.
Also, people on Zoloft, even if they're pregnant, can struggle to connect.
Well, like especially until they can feel the kicks,
Yeah,
like from
yeah.
the outside of the abdomen, because it's this thing like
Right.
okay, it's a
they don't
picture on a
feel any of the
screen, right?
symptoms. Like they can't see anything you're not showing. Like it is very
Right.
easy to feel disconnected.
So,
from.
which I also I've heard that that's one of the theories of why like you make a baby for 10 months in your body, but it comes out looking like your spouse. And evolutionarily, we
Right.
do that so that
They stick around.
males don't kill the offspring.
Like what the like, and you know, honestly, if for anybody that either has been pregnant or is pregnant now or you know whatever, especially after having gone through the infertility process, there are definitely times where I look at him and I'm like, you bastard, you don't have to do anything. I can't fit in my pants.
I don't have pants. I spilled beer on the only pair of pants I own.
Literal direct quotes from me the last like 2 months. And it's one of those things I was like, oh, I have pants that like fit looser or more forgiving, you know, that I'll be able to fit for like X. No, week 5, my ass was like, no, you pants? You can't wear pants.
You also had like the ligament pain that you were like, what
Immediately.
the hell? Like I walked into record, you're like, what is this?
Oh my
My
God.
stomach hurts.
First I thought something was wrong. I was like, why am I had to like look it up, but the ligament pain, which they're like, it doesn't start till second try. No, I had that like at week 5. And even now, like if I laugh the wrong way, or it's usually if I'm laughing, you get these real intense belly pains, from like the ligaments stretching around your uterus. But, yeah, there's definitely like an element, and I know it's definitely not going to improve over time. But you look at your spouse and you're like, if you don't feed me carbs right now, I'm going to riot.
I'm sure you don't want to share the details of the story, but I do remember one part where your spouse was like upset at one thing he had to do for this testing that he could semi-complete at home.
Yes. So another little fun detail of infertility treatments is the semen analysis, which used to be done in the office, which, to be frank, you're jerking it into a cup and they're spinning it and testing it to count like the motility of the sperm and like the sperm count and like how healthy they are.
And then they put it in the tub and they give it a little scrubby scrub.
And then they give it a bath. I wish
That
you
will
could have
never
seen the
stop
look.
being my favorite part.
The look on that nurse's face when I was like, I'm sorry, what? Washed? The frustration. She was like, Jesus Christ. So they now, post-COVID, I guess, they have you do it at home and you just have to like bring it in with like X amount of time, but they want you to keep it like a body temp. So they ask you to like tuck it in your jacket or inside your shirt or like in the waistband of your pants. My spouse was really hung up on having to carry this specimen into the office. Like, how awkward is it that I was like, how awkward is it? Let me tell you, I had to ask them, I had to guide a wand in this morning at 6
I
o'clock.
spend 30% of my entire week spread eagle on a table.
Yes. And sometimes I'm on my period when I have to do it, which
That is the worst. Oh my God. That's surprising. I didn't realize
And
that
it's
you
like
had to
in
have
your
that
brain,
done.
you're like, it's natural. You know, this is like, what's more natural than your period? It's just like when you go to the gynecologist.
Yeah, but
they
I
have
still
you come in anyway.
like I still feel gross
Yes.
during my period. Like
Right.
I understand that like it's obvious it's not like a fucking fire hose coming out of me.
Yeah,
but
no,
like
but
it still makes me feel icky.
Yes.
And having somebody like moving around stuff down. Like I don't have intercourse when I'm on my period.
Same.
So like
I'm the same way.
no.
Just not something I'm down with. Like,
Yeah.
I don't mind my period, like, all the things. I don't mind, like, the messiness of the period and whatever else. And side note, diva cups or period cups really are, like, totally the way to go for me. But I don't want other people associated with it. Like, to me, it's
For
such
sure.
a private thing.
Yeah.
That, just like I don't like going to the gynecologist when I'm on my period. So, yeah, it was, that was a thing I was not fully prepared for. And depending on like when I go, like the first 2 or 3 days are always like the heaviest. And then after that, it's like, it's not as
Yeah.
band. But that's when you're going, is like the first couple of
Right.
days.
Like yeah, they don't give a shit.
Yeah. And that the one morning I was like, man, this period's like really bad. And she was like, oh yeah, blah, blah, blah. It makes your endometrial lining heavier. And I wanted to flip the table. I was like, why the fuck did nobody tell me this?
I think that is also a consequence slash symptom, whatever, of just the pregnancy experience in general.
Yeah.
There's so much to know and so
Yes.
much I think throughout
You're
history.
expected to know.
Yeah, it's like relied on what the women in your family tell you about it.
Yeah.
To expect and like potentially what your mother-in-law tells you about her own experiences
Right.
or whatever. It was like an oral history because again, they weren't writing about it in fucking medical books.
Yeah.
So like women, especially if you were in a rural area, you didn't have a gynecologist. You had some guy who was also like the town judge and like also
And worked at the post office.
yeah, and was the
And did your
veterinarian that
taxes.
did the insemination for the horses. And who would like come over and yeah, they'd like deliver the baby, but like whatever.
Yeah.
Like that frankly after 10 months that's kind of the easy part.
It's wild, and it's kind of like I go to the obstetrician appointments and they're like, do you have any questions? And I'm like,
Always.
I don't. Should I? Like, no, I mean, really, and not to like I don't want to like knock on one, but it's been like a pretty smooth pregnancy. My symptoms haven't been really bad. Like, I've been pretty comfortable.
Well,
can't
and
sleep
we
I
also
can't
have
poop,
Google,
but-
so
and we have Google.
you can like you
look
can
stuff
Google
up.
why
Right.
like what's this pain that I'm having at week 5 or
Right.
whatever.
So, yeah, I go and like, do you have any questions? I'm like, I don't know. Should I? What should I be like? Am I supposed to be asking something that I'm not asking? Because I do feel like there's that expectation, like, oh, you don't know about this thing? No. Why
Well,
aren't you telling me about this
And
thing?
it's because it's so individual though too. It's kind
Right.
of that thing of like, you're like my friend's early pregnancy symptom was that her fingernails hurt.
Wild.
Like, so if that's the sign for her, you had no recollection of that.
My
and
fingernails were fine.
right. Like, like for all I know, my boobs never really get sore when I'm on my period.
Mhm.
Like, I may not have sore boobs.
Oh
as
my
a
god, I couldn't
symptom.
even stand a hug.
No,
I tried to go braless one day and I thought I scrimped. I thought my nipples were gonna wear right off.
like Andy in the office.
That's exactly how I felt. That is exactly, except the thought of having to put adhesive on them would have been like too much. But
Just
it's
holding your t-shirt.
I literally was. I tried to go braless and I was like, oh my god, and I was wearing like a soft cotton shirt and I was like, this is a mistake. I can't do this. This is uncomfortable.
Oh my god.
It was awful.
Yeah,
Anyway,
it's
yeah,
rough.
it's totally, and like I'll talk to my mom like, hey, did you have this? I've had terrible insomnia this whole time. I literally, if it wasn't for Unisom, I would probably be dead by now. And my mom's like, I was just so tired, like I couldn't. I'm like, no, I'm also tired, but I also can't sleep.
Yeah, don't get me wrong.
I am exhausted, independently of not sleeping, but also can't sleep. So yeah, it is crazy that it is such an individual thing, and it's like pretty much anything that can happen. They're like, oh yeah, that can happen with pregnancy. What? I never knew that pregnancy was going to make me as constipated. How come nobody told me that?
Yeah.
Just another side effect that they're like, oh yeah, that can happen. And then you get questions like, are you making healthy choices?
Can you take anything though for your constipation? We don't know.
I don't know. Good question.
Only somebody would look into that, huh?
You can, but they don't want you to take it a lot. So it's like, okay, but what if I'm constipated all the time?
Right, like
Also, what if you're anemic and you have to take an iron supplement that also makes
for
you
sure will make you constipated. Oh my god.
I thought I was gonna die
Yeah.
of constipation.
Yeah.
So yeah, it's definitely like a whole body experience, and no one knows anything.
I will say, as a friend of somebody who is going through infertility, it was worthwhile for me to find a few Instagram accounts of women who were
Mm.
dealing with infertility to give me context for what you were going through so that I didn't have to say like, so what's next? So how are you feeling? So what's going on?
Oh,
Oh, is this like it they kind of like answered all of it because they're kind of like influencer-y.
right, right,
They
right.
would like say those things of like, this is not the right thing to say.
Mm.
Of like, oh well, like if you had a miscarriage or a
Mm-hmm.
mispregnancy or whatever, um, say like, well, at least you know you can get pregnant. No, that's not helpful. That's
Woof.
not a
Yeah.
good thing to say.
Yeah,
Even though
don't.
you're coming from a place of like you said, people just don't know what to say.
Yes.
And like you're coming from this place of like feeling awkward and like you should say something
Right.
because there is that thing of like, well, I know like obviously you're trying, so I know that you wanted
Right.
this
Right.
and you haven't gotten it yet, but also there's nothing I can do. I cannot
Oh,
fix,
yeah.
there's nothing that I could
Right.
offer or give or
Oh,
provide.
yeah. I
Like
mean, it's
there's
just
nothing I
like,
could do to help. So it's easy to like slip into saying the wrong thing with the best of intentions,
mhm,
but it's still the wrong thing.
right.
So, yeah,
And you feel
finding
bad too, because then like there's also the guilt that I'm feeling, because I'm like, I know that I'm unpleasant to be around right now, but it's just like so. It was stressful. I was also doing it in the wintertime,
yeah.
pre-Zoloft.
Yeah, that's the best time
Um,
of year for you.
oh
You're
yeah,
always at your
definitely.
best.
It's what's great is when you have to get up at the butthole of dawn, but it's not dawn. It's pitch black outside,
That's why it's the
and
butthole.
yes, and and it's 5 degrees outside.
Yeah.
It
Didn't
was,
you get
it was
locked
just
out at one point?
oh my god, I forgot about that. So there was there was one morning that okay, so it was like the last check I was having done before I would have to do the trigger shot. So this was like, okay, like we're gonna find out like if this is it, like if it's time. And I had like a 6 o'clock appointment, and I have keyless entry in my car, and I just leave my keys in my bag. So I grab my bag, I go out to my car, I get in, I close the door, and I go to start it, and it tells me I don't have my keys. And I'm like, well, shit. So I go back up to the house. I look in the kitchen window, and I can see my keys sitting on the counter. I'm looking at them, and I'm like, oh, goddamn. So I text my spouse. I'm like, hey, I'm locked out. Wait a minute. Nobody answers. And mind you, like, I'm not leaving early for these appointments because it's so early in the morning and they're going to get me right in. So, like, why would I leave early?
Right, so you don't leave with like 15 minutes to spare or
Right.
whatever. Yeah.
So I'm literally leaving like right when I need to. So I wait a second. I call him. He's not answering. He has 2 phones, so I'm calling his other phone. He's not answering. I'm knocking on the door. He's not answering. I might have rung the doorbell. I must have rung the door. There's like no way that I reached this point
Yeah.
of rage and I hadn't rung the doorbell. I'm like calling other people in the house. No one is answering. Nobody. So at this point, I'm
I
like,
would have that feeling of like, did I die and not realize?
yeah,
Am
you
I
know that
just a
play,
ghost?
that Our Town play where she's like dead and she doesn't realize it? That's what
Yeah.
it feels like. You're like, I'm awake, right? Like I woke up for this appointment. It got to the point where I went to like the window nearest our room and I was just pounding on the window, and he eventually woke up, and I felt bad because he's like half awake, and I like blasted him like, grab your phone, I'm gonna be late this appointment.
I mean, but like
It
honestly,
was awful.
to be able to sleep through that is like it is so frustrating when people don't wake up when you need them to.
You know what's more frustrating is when everyone insists that I'm always up at this time. Being the person that's always up at that time, no, nobody's up at that time. I'm the only one up at that time.
Yeah. Well, you could always have called PK because that man never puts his phone on vibrate ever, unless we're in like a movie theater.
I don't even know the last time my phone was on ring.
Oh no, the other night he slept over and I was like sending shit to the group chat. His phone was buzzing and making noise.
What?
Oh, all the time. But he doesn't wake up because he has a fucking apnea mask, so he's dead to the world. Yep. I was like, then why bother? Like, just put it on silent and
If it
like do
doesn't
not
make a difference
disturb.
to you.
Yeah.
Holy shit.
Oh, I know it is. It will be changing.
I can't even wrap my head around. Like, if I hear my phone, I immediately get like an adrenaline rush. Like,
Because I
I'm-
did that when my phone went off.
if you heard Katie's alarm to take her meds,
We weren't recording at that point, but it was a
It was
little
great.
bit of a drum interlude.
Yeah, it was very funny. But yeah, I don't even know the last time I had my phone on ring.
I mean, I put it on ring sometimes when I'm like especially if like PK is coming over, I'm
Mhm.
expecting somebody to get there,
Yeah.
but I'm also doing other things.
Yeah.
I'll put it on ring. But
I actually, now that I'm thinking about it, I stopped ever having it on ring because I had a really stressful job
I know.
with someone that would call me.
That's why you put me on do not disturb all the time.
I put there's a ton of people on do not disturb because it would like trigger an adrenaline rush
Yeah.
when it would happen. So I was like, a good way to avoid this is if I don't ever have it on ring. And it really it does help. But I don't even know the last time I had my phone like willingly on ring.
Yeah.
That sounds like hell on
It was
earth.
wild.
How does he live that way?
I don't.
PK, how do you live that way?
PK, the people need answers.
We need to know. We should have a poll. How many people
Oh yeah.
ever have their motherfucking phone on ring? Because like I don't even know the last time.
No, that is his status quo. It's more likely to be on ring than on vibrate. Like 8 times out of 10 it'll be on ring.
That's crazy to me.
Mhm. I don't even know what my text tone is. I know what his is.
I used to have if anybody has an iPhone, the Sherwood Forest ringtone used to be my text tone, and I only chose it because my spouse found it annoying. It's the only reason I used it.
You deserve each other. I
Yep.
don't know what to tell you. That
There's two things I relish. We've been together like 12 years now. Times when I can be the annoying one, and times when I can gross him out. Those are I wait for those moments,
Mhm.
and I relish them. I was telling somebody about that text tone thing, and they were like, "That's not very nice." And I was like, "He does shit to annoy me all the time." Guess what?
Not very nice.
You know what it was? It was funny seeing the look of frustration every time I got a text.
Doesn't he set his phone background as like a horrible picture of you or something?
So we do this thing where when one person leaves, if they leave their phone out, we'll take a purposely really bad picture and set it as the wallpaper.
That's what it is.
Which for a long time was always like, got you, and we would like laugh it off. Then I realized he started leaving it as his wallpaper just to spite me, which, okay, you win. That stopped the game. I'm not doing it anymore because he'll like be at work and then this horrendous picture of me pops up on his phone as his wallpaper. So now I have a picture of him, and this is going to sound gross, but in a hot tub when he was 12 with a bottle of champagne as my wallpaper, and I will never change it.
His caller ID in my phone is when he's wearing those big clogs.
That's great. Excellent. And there's a version of me also wearing the clogs, but it's funnier when he's wearing them.
It is.
Yeah.
Yeah.
So yeah, there are things that I relish in being annoying and grossing him out. Actually, grossing Katie out was also on my list of things I relish.
It's harder to do.
Yeah, it's unusual that I'm the one to gross you out.
It's true.
Usually it's the other way around.
Yeah. Well, my mom worked in labor and delivery for 15 years and then worked in the OR. Like, the stories that I've heard are just...
Oh, yeah.
Plus, I love those pimple popping videos.
I used to watch those all
and
the time.
the like, dental descaling videos.
I have not seen that.
Oh, those
I don't
are
know if
good.
I could handle that.
Good.
That would skeeve me out.
Yeah, it makes me feel way better about myself. I'll tell
That,
you
you see, yeah, there is an element of that. Like, when I see somebody with a big growth, I'm like, well, at least I would get my growth taken care of sooner.
Maybe.
Unless it's like this mysterious pelvic pain I was feeling that I realized was round ligament pain, and I briefly thought I was dying.
So, I guess that's infertility?
That was infertility. I've got a couple other, like, points, but, I mean, it's just really... There's like, some studies that they've done about ADHD and PCOS. There's no, like, direct tie linked between the two, and they basically said, like, the research needs, like, more testing done before they can, like,
What?
definitively say
We
that.
finally found the black hole in research.
I know, it's never happened.
Yeah.
Everything we found has been so airtight in the past. They
Shame.
did say that women or people with PCOS are more likely to suffer from mental health disorders, which we covered, that depression, anxiety, but there's also...
it's all hormonal and it will affect your brain chemistry, so...
bipolar disorder, there's also a link with that.
Wow.
Which, I mean, like, if you've got really inconsistent hormones or a major imbalance...
Oh my gosh, that must be so challenging to be dealing with bipolar disorder and PCOS.
Yes. And there's also some evidence to suggest that women with, or people with PCOS that have children, those children have a slight increased risk of developing ADHD and autism spectrum disorders. Which, again, who fucking knows? Because we don't research anything. On the bright side, I did see that there are current studies focusing on genetics in PCOS, environmental exposure in PCOS risk, ethnic and racial differences in PCOS symptoms, medicines and supplements to restart ovulation, obesity in PCOS, as well as health risks for children of women with PCOS. So there is studies happening, but who knows if they'll ever finish it and if there will actually be like evidence to deliver and what they'll do.
Yeah, so I guess that means, vote for people who support federally funded science grants.
Yes.
Yeah.
Yes, because
that's the only way that they're going to keep funding this research.
Yeah. I don't know if anybody's familiar with that movie The Departed, but there's that line where Mark Wahlberg goes, "Qui gives a shit?" And I feel like that's the attitude about all of this stuff. It's like, eh. Or you'll hear some male scientist being like, "Well, until my daughter experienced this," like the fucking
Von Willebrand
dying, and they're like, "Maybe we should look into this."
Huh? That's weird.
Yeah.
Well, the other girls did that.
That one died real fast.
Yeah.
It's fucking crazy. So awful. But anyway, so that was polycystic ovarian, some diabetes, or diabetes, depending on if you're Wolford Brimley or not, or the sugar, and infertility. That was mostly it. And infertility.
Yeah. So that was a good 2-episode series, actually.
Yeah.
Good job.
And we'll continue that too, because I feel like we should also do an episode on like PMS, PMDD.
Yeah, there's been a lot of I've seen a lot of things like PMDD, but then there's also been a lot of requests for us to cover hormones and transitioning.
Yeah, which that's another one like I know is going to be research intensive, so I've been trying to not focus on other things, which, as we know, is hard.
But at least your construction is done.
Yes.
And you can do laundry.
I can do laundry. We have laundry connected.
Yay.
I only had to beef with Lowe's for 3 days.
She farted all the way at Lowe's.
Actually, I probably did. Another pregnancy side effect. Yep, Lowe's flaked on a delivery, but now they're here. I have a washer and dryer connected, from what I can tell. And I don't have people in and out of my house cutting tile, so that's also a plus.
Yeah.
And when I have to pee in the middle of the night, I have a toilet right there.
That's a special order.
Yeah.
And nobody has shat in it yet.
We did have to special order a extra short toilet because conventional toilets are too tall for my little legs. And then my legs fall asleep and my feet swing. And who wants that?
It's like the opposite of Buddy the Elf when he's in the North Pole.
Yes. Yes. I need that toilet in my bathroom, not a regular toilet.
Papa Elf.
Which we only found out by buying a regular toilet before, and I was like, oh, this is too tall. He was like, what do you mean? I'm like, it's too tall for me. So we have, like, toddler toilets in our house. I just need a potty training toilet, and I'll be fine.
Right.
So, yeah, we have a working bathroom and working laundry, which is a vast. And I was able to dust, so I am not covered in a fine layer of dust at all times.
Yeah. So, point being,
some improvements.
Yeah, you'll have
and
the
it's almost
bandwidth.
spring.
Yeah, and you'll have the bandwidth to
I will have the bandwidth.
do the research. And
we
all
will
that
also
stuff.
have more sunlight soon.
Yep.
Which will also help.
Mm-hmm.
Now, if we could just get rid of the snow, I'll be good to go.
Yeah.
And by that time, I'll fully be waddling.
Yeah, and by that time, I'll be mid-move, panicking my life
great.
away.
It's you guys have a lot to look
trade
forward to. We're just going to trade off stressful. We'll just trade stressors.
Yeah.
Back and forth. And
works.
and we'll be thriving the whole time.
Yes.
And make sure you tune into our Patreon to hear me explode a beer. And make sure you re-listen to the beginning of the previous episode when I dumped water all over myself. For more clumsy snippets, join our Patreon.
Well, and really, like, snippet advocacy, really, in that Patreon episode, too. With our rant on farm animal accoutrement.
Yep. There's a lot of farm animal coverage.
So yeah, that's patreon.com/thebarisAnkleHigh. And make sure you leave us a 5-star review.
Become an anklet.
Mm-hmm.
Oh yeah, leave us a 5-star review on Apple Podcasts.
If you actually like write out the review on Apple Podcasts, it's like way more helpful. It gets us more exposure.
And it is legitimately working because we know that we have new listeners.
Yes.
Strictly from Apple Podcasts recommending our podcast organically.
Yeah.
So it works.
So yeah, like you doing, I know it takes like exactly 2 minutes because you actually have to type something.
Mm-hmm.
You don't have to type anything like super meaningful, but like actually taking the time to write out.
Even if all you wrote was gangrenous flappy doodles, it would totally help.
It would make sense to us too.
Yeah.
Poop loop.
What was it? Poop loop?
Poophole, loophole.
That's what it was, not poop loop.
Poop loop is like the cursed roller coaster from that action park place.
Yes. Although sometimes when my dog gets dingleberries, they are referred to as poopaloops. So I think that's where my brain was
probably. But yeah, so that's on patreon.com/thebarisAnkleHigh. If you want merch, you can go to bit.ly/anklehighmerch, all one word.
Or it's also linked on our website, thebarisAnkleHigh.com.
Yes. And yeah, if you want some more natural period pain relief, then go to somedays.com/thebarisAnkleHigh and use the code thebarisAnkleHigh at checkout. That's all one word for 20% off.
Same goes for calm strips.
Yeah, calm strips is Limbo 20 for 20% off on your calm strips, which I still have on my phone and I love it.
Summoner calm strip.
Stop it.
I can't. Every time it comes up, I'm going to make that joke. It was because that one episode we talked about furiously thumbing strips, and it's just too funny to me.
Oh my goodness.
Cannot mention it.
So yeah, thanks for tuning in.
And we will see you next week with something we don't know what we're covering yet.
Yeah.
Bye.
Bye. Thanks for tuning in. We'll be here next Thursday with another episode to tingle your ear holes. In the meantime, the best way to support us is to follow us on Instagram at thebarisAnkleHigh and to subscribe and leave us a 5-star review on your preferred podcast streaming platform. It seems really simple, but it really is the best way to help us out, especially whenever you can actually write out a review. Great news! We have a new merch store that ships internationally and allows you to customize your merch on an endless array of products. You can head over to bit.ly/anklehighmerch to check it all out. If you want even more ankle high hot takes in your life and you have a few dollars to spare, you can also join our Patreon at patreon.com/thebarisAnkleHigh. There's 3 different tiers to choose from: $2 toe rings, $5 anklets, and $10 limbo champions. Everybody gets monthly horoscopes written by yours truly. Anklets get bi-weekly Dysfunction Junction episodes, and Limbo Champions get all of that plus ad-free episodes, and they get added to our close friends list on Instagram. So head on over to patreon.com/thebarisAnkleHigh and join today. Until next Thursday, remember to be kind to yourself because the bar is ankle high.